Today at the Plastic Surgery Channel, we have two experts, Dr. Baxter from Seattle and Dr. Namnoum from Atlanta. We want to talk about recovery from plastic surgery in a time where everybody wants everything instantaneously. Plastic surgery recovery, in my experience, is not instantaneous. How do you guys deal with that, Jim?
You know the definition of fake news in plastic surgery? 2 weeks, ma'am. 2 weeks. Doesn't matter what just like ordering a pizza. Have you ever noticed when you order one pizza, 20 minutes? If you order 20 pizzas, 20 minutes. So the bottom line is that we're all confronting this problem of trying to explain to patients that honestly it's only going to be a couple weeks before you recover. It's not the truth. It's fake news. So what we have to do is lead patients down a pathway that tells them in very concrete terms that it's going to be probably a month or 2 months or maybe even 6 months to a year before they'll feel fully back to normal. Richard, what do you think?
It depends a little bit on the procedure.
Sure.
In general, the shorter the downtime, the less the long-term results. You know, there are things that have very quick recovery, even no recovery, but they're not going to do as much. So you have to just make sure the patient's expectations about the results and about their recovery and their downtime match up.
What's the procedure that you think has the shortest downtime? And define downtime for me.
Well, downtime, there are two aspects to it. One is where you're really just, you need to take medication, you need to be at home, you can't be out and about. Then there's social downtime where, you're recovered enough to sort of get back to your regular activities, but you might feel self-conscious about your appearance, and you're not at that final point of what your results are going to look like.
So I think of downtime in terms of when can I return to driving carpool, if you drive carpool. When can I go out in public and see my friends? When will I not be humiliated? These are the sort of things when I think about downtime. Oftentimes patients say to us, when can I resume exercise? I mean, the reality of it is that it's going to be a while before they can really do the kind of exercise they want to do.
Have either of you found any things that sort of speed up recovery? Are there things you do with your patients that you think sort of makes it better for them?
Oh boy, it really depends on the procedure. Some people recommend lymphatic massage after liposuction or a tummy tuck. I don't know if that really accelerates the recovery, but it certainly makes the patient feel like you're engaging in that recovery process and helping them along.
So there's a sense of trust and well-being and health, and we're trying to always convey that with the patients. I think what Richard said is absolutely apt. In other words, we're trying to make them feel like they're part of the recovery process. That might mean some self-massage or seeing someone who can do some light tissue massage, or their husband, getting their family involved in it, getting them engaged back into their body, I think is very useful. Makes them feel like they're at home.
For more information, you go to theplasticsurgerychannel.com.